Meanwhile, the deaf community has called for engagement of trained interpreters in all healthcare facilities across Anambra State. This was made known in Awka during a project launch on Deaf Inclusive Sexual Health DISH by the Deaf Women Aloud Initiative, DWAI, in collaboration with We Lead and Havos. Onyinye Gubeze has details.
Flagging up the project, the State Commissioners for Health, Dr. Afam Obidike, and his Women and Social Affairs counterpart, Mrs. Ifi Obinabo, thanked the team for their efforts in ensuring the well-being of deaf women in Anambra State. He expressed willingness to collaborate and support the project's objectives. Earlier in her welcome address, the Executive Director of the project, Mrs. Helen Binyoku Alays, expressed sadness that deaf women in Nigeria, including Anambra, are being excluded from sexual and reproductive healthcare services due to communication barrier, stigma, discrimination, and healthcare providers' attitude barriers. She recalled that the Nigerian Disability Rights Act and the Anambra State Disability Rights Act require all institutions, both public and private, across the country, recognize the rights of people with disabilities and provide access to information through the use of professional sign language interpreters. Mrs. Binyoko Alays urged the state government, non-governmental organizations, civil society organizations, disabled people organizations, and philanthropists to work together to ensure that deaf women and girls have equal access to healthcare services.
All state agencies and institutions, government and private across the country to recognize the rights of persons with disabilities, including women. Including women and girls to get access to health information and to have a professional sign language interpreters in public or private facilities, including accessible sexual and reproductive health information and services. In view of the above, we are calling on government, state, non-government organizations, civil society organizations, disabled people organizations, philanthropists to join hands in helping deaf women and girls to have access to health services. We have representatives from the medical associations, Jonapi, and different organizations that are here today for this.
Goodwill message. The chairman of Anambra State Disability Rights Commission, Barrister Chuks Ezewuzie, stated the importance of the study of sign language in school, as well as inclusion of sign language in social and religious activities. He advised members of the deaf community to study disability rights law in order to be aware of their rights. Others who expressed support to the organization were Chairman Medical Women Association of Nigeria, Anambra State Chapter, Dr. Chinenye Onubogu, represented by Dr. Atuebu, the Chairman, the Joint National Association of Persons Living with Disability, Anambra State Chapter, Mr. Ugochukwu Okeke. Short drama about the ordeal deaf women passed through featured at the event.